So BioGrid has done a great effort of not only surviving but thriving over the last 20 years, and I can see BioGrid going from strength to strength into the future with a broader and broader engagement, doing more of the same but expanding on the possibilities and engaging with researchers, delivering what they need in terms of data linkage to drive the research that it's going to make a difference for patients, improving treatments, improving outcome for patients.
One of the great challenges that researchers have in acquiring clinical data is the scale of data that's often needed, and so BioGrid has solved this by having multiple hospital clinical partners across the country. And so you can pool data on any particular patient cohort and be able to ask questions at a reasonable scale. Now, BioGrid have solved all that.
I think that the success of BioGrid in supporting research over the last 20 years has been the way it's always ensured that it collaborates closely with the researchers and clinicians, and in doing so assists with addressing the key questions that researchers and clinicians have.
BioGrid also has the opportunity to bring cohort studies together, to link it to EMR data, and to really undertake very compelling and important biomedical research and really give us answers and insights into some of the challenges facing our healthcare system, as well as diseases and the reasons that people get them.
So I think the biggest contribution BioGrid's made, ironically, is not the technology as such, which that's is great, but it is to bring the patient in focus. And that today describes very much where the direction of all healthcare is headed, engaging with the patient, increasing the quality of data, and linking it in with the classic medical records.
So BioGrid was one of the very first systems that was implemented anywhere in the world that allowed diffuse and distributed data sets across multiple disease areas and, importantly, multiple institutions and investigators to be brought together in a federated way.
BioGrid's success over so many years in solving both strategic problems like ethics, the networking problems, the sharing problems, the data verification, have all been driven by a very small number of people, but they've made a huge impact.
I think BioGrid's greatest contributions are yet to come, with the improvement in data access that comes with electronic medical records and increased recognition of the need for funding of national and international collaboration to build really impactful databases to inform health.
If one can link the data from every single Australian, then you can be sure that the delivery and policy in the future represents the needs of the population. So I think BioGrid is brilliantly positioned to drive that vision in Australia.
I couldn't be more proud of the way that BioGrid has developed. The international collaborations, the national collaborations, bringing people together is the watchword of good research, and the results, the outcomes of BioGrid speak for themselves. So congratulations.